And a very pleasant good afternoon. It's Peter Shad here on a very soggy Sunday, and very happy to have you along on Experts on Call with Dr. Paul Swingle from Swingle and Associates. We'll talk a little bit more about what Paul Swingle does. You'll be very impressed, I know, but the kids are back in school. It's just about October tomorrow. Your kids acting weird? Your friends' kids acting different. Maybe they're acting out. Maybe they're not acting out at all. Maybe they're withdrawn. They're sitting in front of the TV or playing video games. Very interesting show today lined up, and we're dealing specifically with kids. And you're going to learn a lot in this next hour, including what negatively affects the development and the health of children. And every single kid seems to be involved. We're going to talk about that. Also, terrible side effects for medication that is often misdiagnosed or misprescribed. I'm going to tell you what that medication is that is actually very similar to and is a derivative of cocaine, and yet it's being prescribed to children of all ages. And did you know that 1,000 parents between the ages of 40 and 45 were recently asked if you could go back to school and learn one thing, what would it be? The majority of those parents said, if I could go back to school and learn one thing, it would be how to deal with my teenager. Very interesting. All subjects we're going to talk about, some great stories, too, about some actual case studies on the subject of ADD, Attention Deficit Disorder. Often misdiagnosed, very often mistreated. And we're going to be talking with one of our most popular experts here at CFUN 1410 AM. His resume includes heading up the Faculty of Child Psychology at the University of Ottawa before lecturing in psychiatry at Harvard for 7 years before coming to Vancouver. Right now, he's become one of the leaders in the field of biofeedback and neurotherapy, the medical science of adjusting brain waves. Very lucky to have him in Vancouver. He's here live to answer your questions today at 280-CFUN, 280-2386. It's Dr. Paul Swingle, and this is It's All in Your Head. Long time no see.
Been a while, hasn't it?
I missed you, but this is such a big subject. I don't even know if we have enough time in an hour to shoehorn in all the material and information we have to give away today. First of all, let's get into the nuts and bolts of what you do, because I get asked a million times, well, what is neurotherapy? I've had it done myself. I had a sleep problem, and that's been sorted out since. But what is neurotherapy, and why has it been around for 40 years with a lot of people still not knowing what it is?
Neurotherapy basically is looking at brain activity to determine when we have irregular brain functioning, inefficient processing of information. We do that by doing an electroencephalograph, a regular EEG that some people have actually had if they've had a head injury, for example. And we're looking around for areas in which the brain's not functioning well. All of our symptoms, all of our behaviors are associated with brain activity, of course. And if we can find the area of inefficiency and normalize it, then the symptom abates. It's that simple. Now, it's we have a number of different procedures that we use for normalizing brain activity. The first and backbone of most of the treatment is referred to as brainwave biofeedback. Neurofeedback. We set it up so that when the brain is doing what we want it to do, you'll hear a tone or see something move on the screen. Now, for a child, we set it up so that they're playing a video game with their brain, and they love it. But it's basically telling you about a brain activity you couldn't possibly feel, and you are manipulating that brain activity to make a spaceship fly or bugs run across the screen or whatever. And that's nudging the brain towards more normal functioning ranges. The second class of treatments are the brain drivers. And there we measure a particular aspect of brain functioning. Based on that measurement, we stimulate with light, sound. For adults, we use microamperage stimulation, EMF fields, and so forth. And it's updated every second. So we're nudging the brain into more normal functioning or optimal functioning ranges. Now, the advantage of that is the child can be doing something like reading while the area of the brain responsible for that activity is being directly stimulated. Extremely effective method for helping a child read or mathematical problems or whatever. The third class of treatments are things that we ask you to do at home, things like specific sounds that influence the brain in a particular way. And the good news is once it's fixed, it's fixed. We pay a lot of attention to stability, so after the child is functioning efficiently, then we see him twice at about 3-month intervals, make sure it's stable.
That's it in a nutshell. Mm-hmm. And you have a lot of people who come through for various disorders, but I know from past programs, ADD, attention deficit disorder, or attention deficit hyperactivity disorder is one of the ones that brings so many people into your clinic. And when I've been, there's kids everywhere. It just seems like... And they like you, obviously. The kids like you. They feel comfortable about you. And it's important for people to know that you are a full-service clinic with regards to all sorts of other avenues of treatment.
That's an important issue. We have, unfortunately, we have a lot of hobbyists in the area who get franchises to do one-size-fits-all treatment that they call neurofeedback. The problem is one size doesn't fit all for anybody. And we'll talk about a lot of cases in which the child's coming in with misdiagnosis. And if you don't have an adequate background in neurology, you have no idea what you're dealing with here. Parents may need some parenting help, so we do family therapy. There may be a psychotherapeutic component for adults with depression, for example, etc. So we're registered psychologists, and we have a big referral network to the medical community so that individuals come in and we treat all aspects of the problem, not just put an electrode on and leave the room.
He's Dr. Paul Swingle from Swingle and Associates. Swingle, by the way, is spelled Swing-L-E. The website is swingleandassociates.com. You can ask questions on the website, send the doctor an email, find out where the clinic is, which is downtown on Melville Street. All sorts of wonderful resources there, conditions treated, etc. The thrust of today's show, attention deficit disorder, and in just a second you're going to find out, well, what are the symptoms because it is so misdiagnosed. Now, another issue that affects a lot of parents is autism, and I know we do a whole separate show on autism, but Denise has patiently been waiting on the phone lines to talk to you about it. So let's take this quick phone call at 280-CFUN, 280-2386, and talk to Denise. Hi, thanks for waiting. You're on with Dr. Paul Swingle on CFUN 1410 AM.
Hello, Dr. Swingle.
Hi.
I have a question. How is neurofeedback effective for children with high-functioning autism?
We see a very large number of children with autistic spectrum disorders, and our success rate is extremely good. Neurotherapy has, over the last 10 years roughly, has come to be the treatment of choice for these conditions. The higher the functioning, of course, the greater the effects of the neurotherapy. And we see not only children with these conditions, but we see adults with autistic spectrum disorders, including Asperger's. We're now seeing younger and younger children because parents are recognizing some of the symptoms at very young ages, around the age of 3 or so. So we can actually do neurotherapy under those conditions to try to minimize the impact of this condition.
Thank you for your phone call, Denise. Let me give you Dr. Swingle's number. It's 604-608-0444. 604-608-0444. Again, swingleandassociates.com for all the information you need on the web. And in just a second, we're going to talk about today's thrust, ADD, attention deficit disorder, including one child who came to your clinic and actually had stopped taking the prescribed Ritalin. Mm-hmm. And it was a very fascinating family dynamic that I'm sure you see in more cases than not, and this is some of the stuff we're talking about full service, your full service clinic. It's Dr. Paul Swingle. The program is called It's All in Your Head. Our telephone number here is 280-CFUN, 280-2386. If you have a question for the doctor, he's live here till 2 o'clock in the afternoon. This is CFUN 1410. You're listening to Experts on Call. And it's very nice having you along on this Sunday afternoon. It's Dr. Paul Swingle in the house and taking your house calls, by the way, here at 280-CFUN, 280-2386, star 1410 on the cell phone. We're talking about neurotherapy and biofeedback and how it can help you with a wide range of conditions, which, by the way, you can find at swingleandassociates.com, swingleandassociates.com. And, in fact, Dr. Swingle is putting on one of his free annual public lectures, a chance for you to go in person and see exactly what neurotherapy and biofeedback is, what it does, and that's happening on Wednesday, the 17th of October at the Confederation Community Center on Albert Street in Burnaby. It's a 7 o'clock start again, Wednesday, October 17th, Confederation Community Center in Burnaby, a 7 p.m. start, and you could find that information as well at Dr. Swingle and Associates, located in Cole Harbour. Doctor, ADHD and ADD are a main thrust today, and if you have a question about it, you're certainly welcome to call us at 280-CFUN, 280-2386. But here's one of those conditions that is very delicate because it's often misdiagnosed and misprescribed. How do we know when it actually is an ADD situation compared to various other things?
Well, how we know when we're looking at it neurologically is we look at the brain. There are several conditions that are associated with ADD. ADD is not a single condition. In fact, I like to say to parents it's a garbage bag diagnosis. Any child that you're having trouble with is diagnosed ADD or ADHD. There are about 8 or 9 different brain wave anomalies that we find that are associated with some difficulties in school comprehension that we might call attention deficit disorder. The way we tell is to do a brain assessment when the child comes in. We don't ask the child or ask the parents what the problem is. We do a brain assessment and then tell them what the likely problems are. So that's the way we tell. The way it's commonly diagnosed with physicians and so forth is they do a history. They ask the parent, does the child have problems in school? Is he interruptive? Can he sit still at the dinner table, etc.? They have a whole list of things. The problem with those kinds of things is we find that it tells us a lot about the parent and the teacher who's filling out the report. Sometimes it tells us more about those folks than it tells about the child. We find that Ritalin use in families with in a divorce is twice what it is in intact families. Now that's telling us a lot. And there's some preliminary work indicating that teachers who are stress intolerant, there are more kids in the class on Ritalin. Now, there's a case that we were talking about off air a few minutes ago about a family that came in and the child was diagnosed ADD, and he had a mild issue, which we corrected. And his report card was showing A's and B's. The comments on the report card from the teacher about his ability to get along with kids and so forth were fine. They were perfect. The parents said, isn't there anything we can do about this child's ADD? I don't know what we're going to do about it. So we dug a little bit. We found out that the child had been prescribed Ritalin and threw it away. He had stopped taking it a year before he started treatment with us. And he just didn't like the effects of it. And when we looked a little closer, it turned out that the problem here was a marriage that was in crisis. And if that child did not have a disorder, then the marriage would fall apart. The focus of that marriage was on the disorder of the child. Now, we run into this from time to time, which is we have a person on staff, Dr. Terry Rhodes, who's an expert at working with the family dynamic aspect of this. But there's a good example of a situation in which after the ADD, which was minor, by the way, after that was corrected neurologically, the parents couldn't let go of it. This was a case I had, 10 years ago, I guess, when I was at Harvard. But we run into that routinely, where the family dynamic issue is as important as any ADD issue that we're dealing with.
He's Dr. Paul Swingle from Swingle and Associates. The website is swingleandassociates.com. You're listening to Experts on Call here on CFUN 1410 AM. The show is It's All in Your Head, and you touched on two things there that I find particularly important just to emphasize. Number one is with neurotherapy, when you bring somebody into the initial visit, the initial consultation, you know exactly what the issue is without them even having to tell you. So there's never a danger of misdiagnosis, a huge advantage, obviously.
Yes, and that really, we've developed that over the last 10 or 12 years to the point where, as I said, I don't ask people why they've come to see me. I do a brain assessment, and I tell them why they're sitting there. The brain tells us everything, and it is very, very precise. Now, the other side of that is we know exactly where to go in the brain to fix it, so that we're not fixing the wrong problem or making assumptions about what areas of the brain might be implicated. We did a full program. We're going to be doing another one. In fact, our next program is on depression, in which there are a lot of different areas of the brain that are associated with it. And you can be treating with medications, many, many different medications, and not touch the problem because those medications are not touching the specific area in the brain associated with it. Which, by the way, when we talk about misdiagnosis, an awful lot of kids come in who are depressed, and they're giving them ADD medications, stimulants, and vice versa. Children who have a mild ADD situation and they're depressed because they're not doing well in school, being given antidepressants. So it's a very serious problem in terms of medicating the wrong problem and the side effects associated with the medication.
Well, that's the other point that I wanted to bring up was, and I know it's a huge thrust of your program, and that is warnings associated with drug use, and in particular Ritalin, which I mentioned off the top, is a derivative, the same kind of thing as cocaine, which is disturbing, not to say the least. But some of the advertising that comes out at this time of year from the drug companies that make these ADHD type drugs are also disturbing. In fact, you had a great example of one that was run recently.
Yes. This is the time of year when kids buy pencils and pads and knapsacks and lunchboxes. So the drug companies have gotten in on this. Is it time to switch your drug to a new drug when your kid goes back to school? And one ad in a Parents magazine was for a chewable flavored Ritalin, and the byline was "Give me the grape."
Oh.
United States is the only country that violates the UN treaty on non-direct advertising to consumers. And the use of Ritalin in the United States is 10 times what it is in Europe, where the ban is in place. And parents come into the physician's office having seen these ads, diagnosing the ADD themselves, and insisting that they get one of the medications for ADD, and there are a lot of them. Incidentally, the FDA has just come out with another warning in terms of the use of some of these things, and the warning covers all of them: Strattera, Concerta, Ritalin, etc. The effects of it are not benign.
So the child that you saw that actually quit taking it after being diagnosed, there's an example of where sometimes these kids come in and you're actually having to spend some of the time weaning them off the medication before you can actually treat the problem. Would that be a fair thing to say, and that medication is a big issue that you have to treat?
Yes. Now, there are medications that are forgiving. For example, there's some medications that are used in depression that are more easily titrated, more easily to get the client titrated off the medication. The problem with something like a stimulant with a child is the parent is at the end of their rope, and I'm going to give it to him so I can get some peace. So, once we start to work with the parent in terms of titrating the child off the medication, that's a family dynamic issue in terms of what kinds of things that you can do as a behavioral control to modify the child's behavior, as opposed to using a medication to modify the child's behavior. That, for example, in terms of medicating children's behavior, the use of antipsychotics now to control children's behavior and mood has grown at an alarming rate, and that's an off-label use. It's not approved by the FDA to use an antipsychotic like risperidone, Sequinol, for a mood or behavior disorder in a child. And yet, in a study that they've done, only 14% of kids that were on antipsychotic medication had any psychosis. More than 70% were given the medication off-label to control behavior. And for anybody who wants to Google risperidone and look at the side effects, again, we're not dealing with a benign situation, a benign medication. It has serious, serious side effects and implications. But it controls the child.
He's Dr. Paul Swingle. You're listening to It's All in Your Head on CFUN 1410 AM. The number here is 280-CFUN, 280-2386, star 1410 on your cell. Or if you're listening from outside the greater Vancouver area, it's 1-877-280-CFUN, 280-2386. Our subject today is attention deficit disorder, attention deficit hyperactivity disorder, misdiagnosis, mistreatment in often cases. And in just a second, we're going to talk about what you as a parent can do in the event of bullying, which will now have a huge effect and does have a huge effect on the misdiagnosed nature of ADD. You're listening to Experts on Call. This is CFUN 1410 AM. And we're very happy to have one of our more popular experts here at CFUN 1410 AM, a man who headed up the Faculty of Child Psychology at the University of Ottawa prior to lecturing in psychiatry at Harvard for 7 years. And now he's here in Vancouver and become one of the leaders in the field of biofeedback and neurotherapy, the medical science of adjusting brain waves. It is razor sharp to be able to diagnose problems and just as easy for the doctors to fix those problems. And once they're fixed, they're fixed. And Dr. Swingle is here live, and he'd love to talk to you if you have a question, especially about ADD and ADHD. That's the thrust of today's program. I see that, children have been a big part of your entire career. You love kids. They seem to like you because they think you look like Santa Claus, I've been told. But it's good that you're obviously non-threatening. So why don't you take us through what would happen in the case of an ADD child? They come into your office, and how does the whole process work?
Sure. When the child comes in and they're in the waiting room, what I do is I have a look at how they're responding. If they seem to be frightened, then we have to address that kind of issue. If they're bouncing off the wall and the parent seems to be out of control, then that's another issue. Now, the first part of the diagnosis is just having a look. I don't need a brain map to tell that a child has a hyperactivity problem if they come in, grab the paperweights on my desk, and start throwing them around the room. Okay?
Right.
So we've got some things that we can tell right off the bat just by observing. If the child is frightened, I sit down in the waiting room and say, we're going to set you up like an astronaut. That when astronauts are flying around their spacecraft, they look at brain activity very often to see how their brains are doing on the ground while they're up, in the spacecraft. And I said, do you play any sports? And hopefully the child will say soccer. But even if he doesn't, I point out that the team that won the World Cup in soccer, every man on the team did what you're going to do, neurotherapy.
Italy.
And that's why they won the World Cup. Did you happen to see those foul shots that they made? They made every one. You know why? Their brains were working perfectly. So what we're going to do is have a look at how your brain is working. You're going to see this stuff coming from your... By the way, did you know your brain produced electricity?
Right.
Okay. By then, the child is usually comfortable. I'm holding the child's hand. And as you say, I look like Santa Claus.
That's flattering, of course.
Okay, and we come in, and then I don't allow the parent to start talking about their tale of woe. What I say to the child is, we're going to set you up like an astronaut, so come on over here and have a seat. And while I'm trying to set the child up, I'll ask the parent, has the child ever had a head injury in which they've lost consciousness? Because if they had, then the frontal lobes are likely to be somewhat injured, and that can have behavioral implications. So we want to have a look at them. Has the child ever had a seizure? Seizures may suggest some sort of a seizure disorder which can mimic ADD. So we want to have a look at that region. And is the child on any medications now? Those are the only things I want to know. And by the time the parent has responded to that, I'm ready because I have set the child up with a wire on each ear and one on top of his head. And I say, here we go. I'm just going to ask you to open and close your eyes at various times. I'm going to ask you to read something. If the child has a reading problem or is too young, I say, are you a good counter? I'm going to ask you to count, okay? And I'm also going to play a sound that sounds like shh. Now, the reason I play the sound, that's one of those harmonics that we use in treatment that can affect the brain in a particular way. We never prescribe anything for home use that we don't test first to make sure it's going to work. That's why it's so different than the use of medications or any of these other things, or one size fits all. We know exactly what it's going to do before we recommend its home use. Okay, so we start the process. The child sees the brain waves on the machine. I give the child wiggle breaks. I stop every once in a while and say, wiggle break, so that I can get the child to be relatively quiet while we're doing the brain assessment. Then I sit down, do some calculations, and I say to the child, does the teacher always seem to be asking you to pay attention? So I go through the symptoms with the child and the adult.
From what you see.
From what I see on the brain map.
Right.
Okay, so by then the child is usually feeling very comfortable, and I say, oh, by the way, did I tell you about my treasure chest? Oh, well, in my treasure chest there are coins from all over the world, and bills from all over the world, fossils, sometimes real dinosaur bones, and shark's teeth, semi-precious stones. Would you like to have a look? So I bring the child out, and then I can talk with the parent about any serious things that I see in the map. I don't badmouth around the child. I don't pathologize. I always find something positive in the record for the kid. Like his IQ is high, or he's got an artist signature, and frontal lobe's like a rocket scientist, whatever. And then with the parent, if I see a trauma signature, I say, has this child ever been exposed to a serious emotional trauma? Because a trauma can affect the brain and affect retention of information and mimic ADD. That's where I ask about the bullying. By the way, you mentioned bullying before. Mm-hmm. We pick up trauma signatures very often, and the child will admit to being bullied, and the parents often are not aware of it.
Mm-hmm. We'll get to how parents can fix that. But first of all, I'm a little disappointed I never got to see the treasure chest. But also,
you have to show proof of age to get in the treasure chest. You have to be below 12.
But the process really is non-threatening, and it's completely scientific. I think that's what a lot of people don't understand about neurotherapy, and that it is so razor accurate that you can tell all these things without having to ask many questions. And obviously, that's probably why the kids and the parents are a lot more comfortable when they leave.
It is, it's FDA certified and compliant in the United States, same kind of certifications they use for other medical instruments. When people ask, how come it isn't more well known, and my statement is the Journal of the American Medical Association last year got $27 million in drug ads. The biofeedback community at this point doesn't have that kind of money.
He's Dr. Paul Swingle. You're listening to It's All in Your Head on CFUN 1410 AM. You'll find out how to deal with the bully, and we'll take a phone call from Leah, who wants to know about sensory disorder at 280-CFUN, 280-2386. That's coming up next. When we continue with It's All in Your Head, featuring Dr. Paul Swingle from Swingle & Associates. That's swingleandassociates.com, by the way. His clinic is on Melville Street in Vancouver. And you're listening to CFUN 1410 AM. And we are talking about the benefits of neurotherapy and biofeedback with Dr. Paul Swingle from Swingle & Associates, in particular with regards to ADD. Just before we paused there, Dr. Swingle was talking about what happens when a young patient comes in for the first time, and the whole initial process of how he looks at the brain and figures out exactly what is wrong and to make sure it's not a misdiagnosis. And obviously that happens a lot with the medical profession with regards to medication. We're going to talk about bullying in just a second, which is a critical issue these days. But first, Leah's been waiting patiently on our phone lines at 280-CFUN, 280-2386, star 1410 on the cell. Leah, thank you so much for waiting. You're on with Dr. Paul Swingle here on CFUN 1410 AM.
Thank you. Dr. Swingle, thank you for discussing this topic today. I have a 5-year-old boy who fits the profile He's not been diagnosed with ADHD, but he fits the profile more of having sensory processing disorder, and we've helped him a little bit with occupational therapy, but I was wondering if neurotherapy had a place in treating these kids as well.
Yes, we see a lot of kids with auditory processing problems. Usually, there are several different areas of the brain. The auditory processing is one, and they usually have some other condition like excessive amount of a particular waveform in the front part of the brain that affects their ability to sequence and stay on target. But what we do is do a brain assessment and determine what areas of inefficiency. And then there are sound procedures that we use for auditory processing. One of the things that we do is we have some exercises that the child is doing while the brain is being treated. So that we're combining cognitive exercises that are presented auditorially to stimulate the area of the brain that's associated with that activity while the neurotherapy is taking place. So that's what makes it so effective.
Leah, thanks for the question today. And again, Dr. Swingle's number at the clinic is 608-0444, 608-0444. Or just visit his website, swingleandassociates.com. Swingle, by the way, spelled Swing-L-E. And our telephone number here is 280-CFUN, 280-2386. I coach a team of 11 and 12-year-old boys, which is one of the greatest joys in my life, I have to admit. And when you talk to them, just one-on-one, and you hear about the things that they're going through, this bullying thing is quite frightening, actually. It's not just bullying, it's gangs, which is cropping up everywhere, even at that young age. So I had somebody ask me, what as a parent do you do in the event of bullying, which often, and you gave the example, is part of the reason for the change in behavior. What should a parent do?
My feeling is mothers outrank everybody. If you are suspicious of something going on, then you go to the teacher, you go to the principal, you go to anybody that happens to be implicated in this, and you seize control. Parents are very timid about this because they feel they don't want to interfere in the child's life. I think that's a huge mistake. I'm, as you can tell from my gray hair, what's left of it, I'm from the old school. Parenting is the number one issue here. If your child's in trouble, you outrank everybody.
And some of the kids who are picked on often won't say anything either, will they?
Yeah, that's really sad to see, and I see a lot of that. A child that's unpopular is very likely to be bullied. And the bullying is not physical, so it's not something that teachers are likely to see. It has to do with snide remarks, insults, verbal abuse, and isolation. And the child is concerned about reporting that to an adult. In fact, the research on that is quite clear. These children typically do not report that to an adult, because if they do and the adult handles it badly, the situation gets worse, a lot worse. So the child is kind of forced into this situation. Their peer development is affected. Their ability to feel good in their learning environment is affected. If they start to develop trauma signatures on the brain, which is a deficiency in a brainwave associated with the retention of information, it can have a physiological impact on their learning ability. So it's not a trivial issue. And some schools do everything possible they can to try to control it. But if you as a parent recognize that something seems amiss here, take control.
And that, of course, can be also seen or misdiagnosed as...
We get that all the time. A child comes in and they're being bullied. They don't have an ADD problem. They have a problem with not being able to defend themselves in this kind of environment. And the gangs now are getting really, really problematic, where it's a physical danger to a child.
Dr. Paul Swingle is here. This show is called It's All in Your Head on CFUN 1410 AM. The telephone number here for questions to the doctor, who is live at 280-CFUN, 280-2386. On your cell phone at star 1410 AM. And I want to get into this very interesting document which you brought in today. And it's the negative effects on children's health and development by television. and video games. And, in fact, you're making this document available to anyone who calls the clinic up tomorrow morning, I guess, or do you want them to email? How do you want them to get in touch with you?
Give us a call, and we can either email a copy to them or we can mail them a copy, whatever they'd like.
608-0444, 608-0444. So, I mean, this is something that probably we've suspected for a long time, but now there's a rather, black and white proof that video games and television have a negative impact. How?
It affects the child's ability to sustain attention. It affects their health. It affects peer development. If the child is exposed to TV at a very young age, in an area of the brain that doesn't develop properly. So it's not a benign issue. The Pediatric Association in the United States recommends less than 1 hour screen time a day. Now, that's video games and TV. 1 hour, less than 1 hour a day. And I tell parents, treat it as a toxic substance. And you live in the real world, they're going to go over to Johnny's house, and Johnny's mother doesn't care about TV, so your son is going to be watching TV in Johnny's house. You can't control that, but you can control your own environment. And this is, again, mothers outrank everybody, including the television.
And so somebody who sits in front of a computer game for 2 to 3 hours a day and then watches their favorite 3 hours worth of TV, could that actually show on a brain map when they come in?
You bet.
Wow. Well, the document is available for you to read. It's very interesting, and there's all sorts of stats and research from various different sources. Again, Dr. Swingle's number is 604-608-0444, 604-608-0444. Call the clinic up tomorrow, and they'll get you a copy either by email or they'll mail it to you. And when you go to the website, you'll find the telephone numbers and email addresses at swingleandassociates.com. That's swingleandassociates.com. In just a second, when we continue, you had a patient come in who was a little concerned about her acceptance to university, wasn't doing very well. I'll tell you her story, and also a young violin player,
yes,
before and after neurotherapy. A very, very good story, and that's coming up next when we continue with Dr. Paul Swingle, and it's all in your head here on CFUN 1410 AM. Still time to sneak in a phone call to Dr. Paul Swingle, who is an expert in the field of neurotherapy and biofeedback, the medical science of adjusting brain waves. We've been talking about ADD this hour, and the telephone number is 280-CFUN, 280-2386, star 1410 on the cell. And you had a young girl she came in with her family, and I guess, was it an ADD case or was it something else? So the parents thought there was something not quite right. You went through the process, which you explained to us, the treasure chest and all that kind of stuff. Give us the before and after.
Yes, this was a young girl who was having a lot of difficulty in high school, and she spent a lot of time, doing homework and just wasn't doing well. She had a form of ADD that or at least I tend to see more in females than males, and it tends to go undiagnosed. It's what I refer to as a high alpha form, in which is an excessive amount of alpha brain waves. Those are brain waves between 8 and 12 cycles a second in the front part of the brain. Now, the effect of that is it affects your ability for planning, organizing, sequencing, and following through on things. So you start one thing, end up doing something else, don't quite know how you got there. It affects your attention. The other property of it is it very often affects chattiness. So, and unfortunately, for the stereotype we have of young girls, that this fit the stereotype of somebody who is very social, very nice, but not too bright. Okay, and that's what she carried around with her. And it turned out that that's the form of ADD that she had. We corrected it, and she did extremely well in the last few years in high school. And I just got an email, I think I was mentioning it to you at break time. I just got an email from the mother thanking us for the work that we did with this child. She's in university doing very well.
Wow, and you get those all the time. SwingleandAssociates.com, by the way, is the website. And this is the kind of thing that happens in the clinic over and over and over again, and there's no use of medication. Once it's fixed, and then you get these great follow-up emails of people thanking you. Which brings me to, you mentioned high school and university. What is the age range of ADD? Does it only affect younger kids, or how does that work?
No, we see the full age spectrum. It's unfortunate when you see a person in their 40s who has had undiagnosed ADD. If it's a male, they tend to have a problem with addiction. They can't hold a job. They've been through a number of relationships. They're really down on themselves. And they tend to incorporate that into the view of who they are, which is really a problem. They'll try to present themselves, I'm just an easygoing, laid-back, disorganized kind of guy. The fact that they're there means they don't believe that for openers. And I just tell them, I say, you don't believe that. You wouldn't be here if you believed that. So, and in females, particularly the ones that have this undiagnosed form that you see more in females, they're very disheartened. Their careers have just not gone anywhere. They can't seem to stay on target, and they're usually very depressed. And they usually walk in having been diagnosed with depression, and they're on an antidepressant, which is not doing anything for them in terms of career development and all the other things that are concerned. So we have a problem there. We have to get them off the antidepressants and then fix the ADD problem, and any reactive depression they may have, we may do a bit of psychotherapy with them or counseling to help them get that sorted out.
Now, as far as getting treatments done, I know everybody's different, but generally speaking, is this a difficult issue to treat as far as biofeedback and neurotherapy is concerned?
Oh, ADD is that's an easy problem. ADD and depression, where we get into serious problems, working with things like severe excessive compulsive disorder, the seizure disorders, head. We deal a lot with traumatic brain injury, that sort of thing. There's some forms of ADD, 15 sessions, the kid's out of here. In fact, that's the violin girl that you like to refer to. Some of these patients come straight from heaven. This little girl was 8 years old. She came from a loving family in which she was absolutely, to the depth of her being, she knew that the parents' love had nothing at all to do with her accomplishments. Her parents just loved her. So she would come in, hop in the chair, very giggling and so forth, and she just had a minor ADD problem. It was just a problem for her to sustain attention. 12 sessions later, she was out of there, and I got an email a letter actually from the mother that she had gone to a new school the next year. And on the second day of class or something like that, first week of class, she came in to play a violin solo in front of the class. And the mother said last year that time, it would have been impossible. You fix self-esteem, you fix everything.
He's Dr. Paul Swingle from Swingle & Associates. Swingle spelled Swing-L-E, swingleandassociates.com. Let's get into some quick nuts and bolts, the cost involved in neurotherapy biofeedback with you guys.
Sure. The intake assessment is $180. The treatments tend to average around $115 each. Most of them are at $105. There are occasional ones at about $140, depending on the level of service required. It is covered by extended medical. Whatever you have for a registered psychologist is what you'll get back. What isn't covered is a tax-deductible medical expense, because this is, psychological treatment from a registered psychologist. It's not a one-size-fits-all franchise.
You are a full-service clinic, in other words.
That's right.
And you have a book coming out, as well as your annual free public lecture, which is Wednesday, October 17th. You could find that at the website, by the way, swingleandassociates.com. But you have a book coming out to explain for us lay folk what exactly it is you do.
That's right, Biofeedback for the Brain. It's coming out with Rutgers University Press, and it should be early part of next year. And it's the kind of thing that a parent would find useful if they're going to have neurotherapy for a child. There are a lot of neurotherapists around in North America. I mean, I'm not the only game in town. There are 10,000 in the United States. There are none in Vancouver other than in my clinic. The one woman who had a practice had to close it for health reasons. So we're the only registered and certified people in the province.
Well, and because of that, you are busy, and you do have people coming from all around the province. What's the waiting list right now? Do you know?
6 or 8 weeks, something like that.
But then again, you do have cancellations, so give the clinic a call, 608-0444, 608-0444. For any other questions, you can find them all at the website, swingleandassociates.com. Swing-L-E is how it's spelled, swingleandassociates.com. And again, if you want a copy of that interesting article on negative effects of TV on children's health, just give the clinic a call, and they'll email it or mail it to you. Next time you're back in mid-October, October 14th, we're going to talk about
mood disorders, depression.
And as we always do, to end the program, we'd like to play your favorite song from Louis Armstrong, It's a Wonderful World, because
it's a wonderful world.
See you in 2 weeks.
Take care.
I see trees of green, red roses too. I see them bloom for me and you, and I think to myself, what a wonderful world. I see skies of blue and clouds of white, the bright blessed day, the dark sacred night. And I think to myself, what a wonderful world.